Hello, everyone, and thanks so much for joining us for today's monthly free webinar from the Center for Financial Social Work. I'm Rita Wolfson, and our wonderful guest speaker today is Michael McMorris. I'm going to ask Michael to do an introduction of himself when I hand this off to him. And he will be speaking on helping clients cope with the costs of medical care. We know what an important topic it is and what a serious problem this is, and I think you'll all be glad that you took the time to join us today. I first met Michael about a year and a half ago. Well, I met him virtually, as so many of our meetings these days are. And from the moment we started talking, I was fascinated by the work of his organization. It's called PAC Health, and you'll be learning more about their work. But the more he said, the more I realized that this was a behavioral approach to healthcare. And I had certainly never heard of anything remotely like it. So we are very proud to have him speaking to all of you today and to have this relationship with PAC Health. And they have certified some of their their health coaches in financial social work, which of course makes this a perfect marriage of behavioral approaches to money and to health. So to begin, just a little overview that all the slides are proprietary, so we won't be sharing them, but we are recording this webinar and you will receive it in your inbox next week. And throughout this webinar, you may type in your questions into the question box, and Michael will be answering them at the Q&A session at the end of the webinar. So because we know that we always have a significant proportion of new people to financial social work, we're going to begin with a brief introduction to our work so you know why we go to all of the effort to bring you these monthly free webinars. And I'd like to begin. I have one poll, and then Michael will have a poll for you. So my poll asks you, where are you joining us from? So I'm going to launch that poll. And we often do have people from other countries. If you are from another country, you can type that into the chat box. And Vonda, maybe you can check that and see if anybody puts that in. Okay, we're fairly spread out today. The majority of you have voted. I'll go ahead and give it just a few more seconds so that everyone has a chance. And then we're going to close it and share the results with you. Okay, so you can see the majority of you are from the southern part of the country, and the rest of you are somewhat spread out. Okay, so we'll hide that poll and we'll keep going. Okay, so just some basics on financial social work. Financial health is about more than dollars and cents. Okay, let's get this right. So this is our financial wellness model. We really look at financial well-being as being about a client's relationship to his or her money and self. And it's those relationships that drive all of our financial behavior, our clients and our own. And it's that financial behavior, how we earn, spend, save, share, and borrow, that determines our financial circumstances. Is it a simplification? In some ways, but honestly, if you really think about it, it's how we earn, spend, save, share, and borrow that determines how financially healthy we are. So you can see my little arrow that that's where financial behavioral change happens. So I talk about relationship with money and relationship with self. It's about how we feel about ourselves, our sense of self, our feelings about esteem, self-esteem, self-acceptance, and again, how we earn, spend, save, share, and borrow. So we have a financial health model that looks like this because there are so many components. So when I talk about the fact that it's financial health, it's about so much more than dollars and cents. It's all tied up in the money, our relationship with the money, our relationship with ourselves, our financial behavior. I've emphasized those a lot already. But how about the other people in our lives and society in general? Everything from social media to our friends and family and the ways that they deal with money. And where we are in the life cycle determines a lot of that. And our health, our physical health, our mental health, these are all components of the whole person financial health model. And this is our financial life cycle model. We believe that we know that we need to be age appropriately introducing this topic in order to avoid the financial illiteracy that plagues so many people in this country. So from an early age, exposing children to the topic, and by preteen discussing money with them, by adolescents, allowing them to have hands-on experiential learning. And you can see from young adult and adulthood, and then in older adulthood, passing it on, either the assets or the learning and the knowledge. So our financial social work model is ongoing, highly experiential. It is a behavioral model that is very psychosocial. We look at the thoughts, feelings, and attitudes that drive that behavior. So it incorporates ongoing financial education, motivation, validation, and support. The model is interactive, introspective, and strengths-based. It works individually and in groups, and many of our graduates use it to practice financial therapy. It incorporates a psychodynamic model of Maslow's transformative learning, along with the trans-theoretical model of behavioral change, which really addresses meeting the client where the client is in his or her financial life. So dollars and cents do not make our financial decisions. It's our inner money self. And we all have an inner money self. And if we had the time, I would ask you to introduce yourselves to your inner money self, because it has so much to teach each of us, because we need to be healthy around our money and ourselves to be strong, healthy role models and therapists or financial educators, counselors. So think about that inner money self piece, because our financial circumstances originate from within the inner money self. And it's our inner money self that really addresses the psychosocial component I've talked about, those thoughts, feelings, and actions with our money and with ourselves. So we talk about financial healing, and that requires addressing the emotional, physical, mental, and psychological damage and challenges of the financial problems we have, and overcoming some of the learned behavior and healing and determining which of our financial behaviors or habits help us and which are harmful. So financial well-being, our definition is embracing the financial component of your life. So money is not a constant concern and stressor. Actually, 8 out of 10 Americans say that money is their number one stressor. So financial well-being, feeling and being more in control of your money and life. Because until you take control of your money, you're not likely to feel or to be in control of your life. So this is what it's about for us. It's about making peace with our money. And I can't think of a better goal for anyone, because someone with a healthier money self engages more readily, is more hopeful, is more eager to change, and more prepared to succeed. So now it gives me great pleasure to introduce our guest speaker and to ask him to just talk a little bit about himself as I turn the webinar over to him. Okay, Michael.
Okay.
Go ahead.
All right. So thank you so much, Rita, for our partnership that we've had so far, and thank you for hosting this webinar for us today, and for giving me an opportunity to share a little bit about helping clients cope with medical care from our perspective here at PAC Health. And thank you for the financial social work community for tuning in, and for other people who are joining from maybe other avenues, but glad to have you with us today. And we're definitely going to be sharing a little bit about helping your clients cope with medical care. But first of all, just a little bit about myself. So what we want to do is tell you a little bit. So you have my certifications up there. So everybody pretty much knows what MSW is, a Master Social Worker. And then also NBCHWC, you may not know what that is, but that is simply a National Board Certified Health and Wellness Coach. We partnered with the ICHWC, and we have partnered with them. They have offered the very first certification for health coaching in the country, and so we took advantage of that, and we want to, so I became a National Board Certified Health and Wellness Coach in September of 2017. So right, and so I work here at PAC Health. I practice, what we do here at PAC Health. And what we are is we're a company that helps people manage a chronic condition, or who are at risk of developing a chronic condition with a behavioral model. So that's really one of the first things as I was researching other certifications to go along and supplement our financial piece that we teach our clients. Came across financial social work, and was a really good fit, because our specialty is in behavioral health and help people, manage their health behaviorally. We don't come from it from a clinical perspective. And so I was really excited to see a lot of the same the model that financial social work use. It's a really good marriage, as Rita said earlier. And we have currently 4 health advisors, including myself, on staff who are certified financial social workers or financial coaches, and just to offer our members, more services if they need some additional help. So as we get into this, helping clients cope for the cost of medical care, I want to share a poll first of all to get us going. And so we're putting the first one up right now. And it is, what percentage of, total healthcare spending is made by people living with a chronic condition? And there are your choices there. So if you just take a moment just to hazard your best guess or educated response, would be great. And we'll close this in just a few more seconds as soon as we get pretty much everybody who has voted or wants to vote. Okay, so I think we got a pretty good result here. And so pretty much evenly split, 30% between 65, 75, and 86%. And so 30% of you are correct, by the way. So which is the 30%? And as you can see here, that the CDC states that 86% of the nation's 2.7 trillion annual healthcare expenditures are for people living with a chronic or mental health condition, and that's a pretty sizable amount. And as many of you know, and people that live with, on average, people that live with a chronic condition spend about 5 times more on healthcare than other individuals who may not have a chronic condition. So there are definitely, so as you're working with your clients, if you are asking a little bit about their health, if they're living with a chronic condition, then chances are they're spending a sizable chunk of their budget towards healthcare expenditures. And the CDC states that these costs can be reduced. And of course, the healthcare system, if you're tuned into any of the happenings through like the Affordable Care Act over the last several years, that the healthcare system itself is moving away from a fee-for-service type of a model to a value-based reimbursement model. In other words, that clinicians and hospitals and healthcare providers will need to show that people are getting healthier, because as people are getting healthier, then it stands to reason that their healthcare expenditures can go down. But then also, we believe that it needs to be addressed individually as well, because as you see on this slide, that the patient's experience of healthcare costs, that medical expenses are all interrelated with lifestyle, health behaviors, and health outcomes, that they're all, interrelated together. So for instance, we come from this helping people to manage their health behaviors. So if we're helping people to eat healthier, exercise, and take their medications, then it shows that, we've been able to improve health outcomes. Especially we've seen a reduction for people living with diabetes. The marker is, the benchmark is A1C, HbA1c. And we've seen on average, the last research that we've done internally, about a 1% reduction in that. And we've also seen people report back to us a reduction in medical expenses as a result of getting healthier. And so they're all interrelated. For instance, just a few weeks ago, I've been working with a member, and we call our clients members, by the way, so if I use the word member or client, then you know what I'm talking about. But this member, she enrolled in our weight management program, and she was also living with gastric esophageal reflux as well as chronic fatigue. And we begun to look at, she began tracking her diet, exercise, medication routine, and so we began to modify that a little bit and helped her to see where she could eat fewer carbs. She was really eating a lot of carbohydrates, which were contributing to her fatigue levels, as well as other factors. She got more fiber in her diet and started getting regular exercise. And she reported to me like 2 weeks ago that she stopped taking 2 medications under her doctor's advice because she did not need to take them any longer. One of them, did some research on it, retails for about $480 a month for a 30-day supply. And the other one was right about $60. Of course, she may have been paying less for this because of copay, but still, somebody's paying for the retail amount, either through her health insurance or somebody else. So she's definitely saving money, and then we're also saving money in the entire healthcare system by and large, because if people are healthier, then they're consuming less healthcare, and we're seeing better health outcomes as a result. So how do we do that? So how do we tackle health behaviors? Well, here at PAC Health, we have a core program. It's the initial 12-week intervention. And during this time, how we do what we do is we send out our members or clients, a PAC toolkit. And so these are educational tools and materials that we'll use throughout our 12-week intervention. You'll see a picture here of the tiny step magnet that we use, which we'll talk about in a few minutes. But this is just one of the things that we provide in this small toolkit that we'll use throughout our intervention. And we couple that with a dedicated health advisor. And our health advisors are, you may ask, who are your health advisors? Well, I'm a health advisor, so my background is in medical social work. But we have people here working in, came out of public health, psychology, exercise physiologists, nutritionists, registered dietitians that are also on staff. So that are also health advisors. So we've built really a multidisciplinary team here approach to our approach as well. And so it stands to reason that if I, as a social worker, need a question about nutrition, I could just go to a team member of mine and ask him or her about the specific question that I need and get it answered according to their expertise. And so we pair up our clients or members with not only the PAC toolkit, but also a dedicated health advisor. And once a week, we call our members on the phone. It's a conversation that lasts on average about 14 to 15 minutes. And we'll talk about one specific topic a week related to managing their health. And as you can see, some of the topics on the left-hand side that we cover, we do set goals. We set SMART goals. As you're familiar in the financial social work community, we set SMART goals with our members related to their health. Whatever, and this is a goal that's specific to them. So this is our members' personal health goal that we're working on, as well as providing the education and other support as they go through the program. We send out, after the call, we send out nudges that we call nudges. These are text messages or emails or short 1 to 2 sentences that encourage them to continue to follow up with their plan for that week or their tiny step for that week. So they set a main 3-month goal at the beginning of the program, and then each week we'll set small tiny steps as we go through our program. And these tiny steps are designed in a way just to simply help them to to tackle a larger health goal. It's been proven. It's the BJ Fogg model, the Fogg model of behavioral approach out in Stanford University in California. But the tiny step approach, instead of changing everything overnight, which we believe is a recipe for failure, we want people to make these small, tiny adjustments and gradually improve them over time and increase them over time, which can really help them to reach larger health goals easily. And then also they complete a weekly activity for us, which is a micro lesson, and it has surveys. It has validated scales that we use that they'll answer to prove that what we're doing actually works. And we have shown, as we'll see in just a few minutes on our financial piece on health budgeting, as you see on the very end thing, we do tackle financial costs related to healthcare. And so how do we do that? Well, we measure our success by using a cost financial toxicity scale, and these are just some of the questions that are related to that. There are about 11 questions in total, and so our members will answer this questionnaire at the beginning of the program, and they'll answer the questionnaire at the end of the first 3 months as well to see how well we've improved. And so some of the results are that we've proven is that as the member takes this scale, it gives us a score. And the very next slide will show you how the scoring goes for this toxicity scale. That if they're above 26, then it means that the financial aspects of their condition management have no impact on their quality of life. And then as you see, higher scores are definitely better. And as they score lower on this scale, then it is showing it has a higher impact on their financial life. And so we see this as health advisors. We see the results, and this is just a sample on the very bottom. It's a sample way that we see that, in general. And so we've been able to show the results through our initial 12-week intervention that at baseline, 52% report financial aspects of their condition management do have an impact on their quality of life. And after 12 weeks, that percentage falls to 41%. And so as you can see, this is a statistically significant difference overall. And to get a little bit more granular, or to zoom in a little bit more on specifically what's been the improvements. So for instance, this just gives you 3 examples. I feel financially stressed. You know, who among us, or we're working with our people, our clients, know that people are financially stressed. And so the results are, we're programmed that 9% more of our participants are not at all or just a little stressed after PAC Health. And I worry about financial problems I will have in the future as a result of my illness or treatment. That 11% or more participants are not at all or just a little bit more worried about working, a little worried after working with PAC Health. And then the last one is, I know I have enough money to cover the cost of my treatment. And 10% more participants responded by quite a bit or very much that they now have enough money or after working with us to cover the cost of their treatment. So that just kind of shows you our results. And so we've been able to prove that our intervention works on not only just the financial piece, but in other areas as well. And so how do we address, and so let's begin to kind of get into the meat of our presentation today, is how to approach financial topics, you know, with people. And how we do it here at PAC Health is we just don't do it with one approach. Of course, we have as we talked about, people know we're going to talk about this because at the very beginning of the program, they fill out a 45 to 50 question survey activity that includes the cost financial toxicity scale. And so they take that, and we ask them if they have any questions about it. And sometimes people do, sometimes people don't like it, and let me know this. Other people are really appreciative that we are, addressing this issue. Because most people living with chronic condition, as we've already shown, that have financial pain points and are very willing to discuss those with us. We provide education materials and tools through the PAC Health Toolkit that help them a little bit, and we'll show what that looks like in just a few minutes. We also ask the difficult questions, and just asking open-ended questions, about their financial life. Like, for instance, well, tell me, what would you like to share with me about, how you're managing your healthcare costs? Those types of questions. Get people talking, sharing stories about their journey with managing their chronic condition and their financial life. And also, it's just a part of the intervention. We normalize it. It's very common. We share that people living with a chronic condition, it's very common for people to be struggling financially as a result of that. And then we also wait until later in the program to really get into this. It's the very last topic that we'll address before we start closing down the initial phase of our program, the initial 12 weeks. So we wait until a little bit later in the program after we've developed a lot of trust and rapport, which we'll talk about how we approach that later on as well. And so this is just a sample of what the members get in the toolkit. They get what we call a self-care guide if they're managing a chronic condition. And this is just one piece of that self-care guide. We have other information in there, topics related to those health behaviors. And so we talk about health budgeting, and we share with them that this is very common. This is very common for people to be financially stressed, and people living with chronic conditions spend 5 times more on healthcare than people who do not. And that healthcare can be expensive, and we share this openly with them, about things to read ahead on. If they have any questions, they can ask them to us at any time during the 12-week intervention as well, related to financial aspects of their condition. And so here are some things that that we will address and we'll talk about during a health budgeting call, for instance. We'll talk about the importance of having health insurance. I know that many of you, if you're working, if you have health insurance, or if you've ever been without health insurance at any point in your life, you know how stressful that is. You know how that makes you feel, wow, if something happens to me, I don't know, have a sense of insecurity about that. And so we talk about the importance of having health insurance or maintaining health insurance as well. And we'll share about where we direct them to go if they don't have health insurance in just a few minutes. But we also talk about the importance of maintaining a spending plan. I know Rita might be happy that we use the word spending plan, in that instead of a budget. But we encourage them to include those regular medical costs in their monthly or annual spending plan. And if they don't have a spending plan, we will help them to develop one. I mean, that's part of what this process is all about. But we want them to include those regular medical costs in those plans if they have them. And we also have them save for medical emergencies as well. We know about the importance of saving, in the financial social work model, but are we saving for medical emergencies? And we use the member's deductible as a point of reference here. So for instance, I don't mind sharing this. On my healthcare plan I have here at PAC Health, I have a $1,200 deductible for myself. And so that lets me know I need to save at least up to that $1,200 deductible to cover those irregular costs that will come my way before my insurance starts picking up the rest of it. And so those are some things that we share with them. We direct them back to if they're working, we direct them back to their human resources department or HR to take advantage of employer-based financial products. And those are things like flexible spending accounts, and give them education on what those are. Health savings accounts, and we give them that education as well so that they're more educated about these financial products that are available that not only can help them to budget for their healthcare expenses, but can also help them to save money on taxes, because these are financial products that are regulated by the IRS, and they can take advantage of a lower tax rate as a result of saving this money pre-tax versus not doing that. So we definitely will direct them there. I've had many, as many people, we partner with employers where we get some of our members from referrals from employers, and I've been able to direct people back to their human resource department to arm them with this information about these financial products that can really help them in the long run. We also educate on the appropriate use of the ED or the emergency department. Unfortunately, there are many people that do not have health insurance and often will end up in the emergency department, for healthcare costs, but it's very expensive. I think I looked at my health insurance recently, and a copay to go to an emergency department visit, if it's not an emergency or deemed an emergency, will be $300 copay versus a $30 copay I have when I go to my primary care physician. And so we help people. Of course, we never tell them, if you're in an emergency, go by all means, but we're not prescribing this as, don't ever use emergency department. But, if they can call their primary care physician, or just to kind of get some feedback that, sometimes a primary care physician might help them to, send them, hey, you can just cover this by medication and we'll send it to you. And then, of course, we also address medication costs. These are really, really, probably the most, the biggest financial pain point that I talk to with members are medication costs. And so we talk about the importance of getting their prescriptions changed from a 30-day supply to a 90-day supply. So for instance, I took this, advice myself. I do take some maintenance medications myself, and I have one medication that, I have a $9 copay every 30 days. So I got my doctor to change it to a 90-day prescription, and I can get the same prescription for $9 every 90 days versus $24 every 30 days. So it really saves me some money. We also help our members, arm them with questions to ask their doctors, going back to their primary care physician about generic medications and getting possibly those medications reduced, their cost there. And then also just talk back with their clinician or pharmacist if they just cannot afford a medication. I don't know how many people that tell me that, yeah, I have this medication that my doctor gave me, 90 days ago or 9 months ago, and I wasn't not able to fill it because I can't afford it. And so, I think doctors are very knowledgeable about this these days, and so we always, direct them back to their clinician or pharmacist to, help get direction on where to go, maybe get a different prescription as a result of that could be covered under their insurance or might be cheaper for them. So those are just some of the things that we talk about and address most commonly with our clients related to those regular medical costs and some of those irregular medical costs as well. And of course, so where do we send people? What are some resources that are available out there for people managing a chronic condition? So if they don't have any health insurance, of course, we direct them to the Affordable Care Act website, healthcare.gov, which I don't know with the current administration what exactly is going to be the long-term outcome of the Affordable Care Act, but with that said, we do direct them back to the to the Affordable Care Act for individual insurance if they don't have access to it through their employer or anybody else. And we also can help them walk through that process with them. There's also a really neat website called Health Sherpa. Health Sherpa, I don't know if any of you have enrolled yourself in the Affordable Care Act website in a plan through the Affordable Care Act, but you really have to fill out a lot of information before you actually begin to see how much the plans cost in your state and what are available to you. And but it's a lot of information. Believe me, I've had my own individual plan through the Affordable Care Act website. But Health Sherpa allows you to plug in 5 pieces of demographic information, and you immediately begin to see the plans that are in your area, which is really neat. So they can really see, well, can I really afford this? Can I not afford this? And kind of go from there. Also, we also direct them, as I said before, to their Human Resources Department for employer-based financial products, flexible spending accounts, health savings accounts, of those things of that nature. And then also we partner with a company, organization called Needy Meds. I don't know if many of you have heard about Needy Meds, but it's really a really wonderful website, organization that really can type in the name of the medication or type in a condition. And it really is a wealth of information on there. So it's a wealth of information related to copay coupons for brand name medications to help reduce the cost of copays for the member. Patient assistance programs. So for instance, if a person has Medicare or Medicaid or dual covered that they cannot use those copay coupons, then maybe they could benefit from a patient assistance program offered through the medication manufacturer that they have on, but where do we go to get that information? It's kind of hidden. So, but they make that known that it's available, and oftentimes there is an application on their website that you can download and fill out either for your client or give it to the client themselves to fill out. And they also have some really good health education on there as well. And they do host webinars, and just for a little plug here, I will be doing a webinar in about 2 weeks through Needy Meds, more focused on individuals and helping them with, developing a financial budget, that kind of thing, or spending plan, I should say. And things of that nature. So it'll be more geared towards them. So if you have any clients that might need some help, you can direct them there. We'll be doing that in a few weeks. But we also give our members a discount drug card, through Needy Meds, which can help people definitely, if their insurance does not cover a medication, or they don't have insurance, that this could save them some money if they just present it to their pharmacist at that time, at the point of sale. And of course, stress management is really important, and I really appreciate the financial social work model that includes a discussion around stress, and that there are multiple sources of stress. And I don't have to tell any of you that definitely financial, having finances can be a source of stress in our lives and the lives of your clients. And so we bring in resources or support for the most pressing need for that member as a result of that. And all the behaviors that we're addressing, like exercise, healthier eating, getting better social support, getting better sleep, developing hobbies, addressing financial resources, or just whatever works for them, all of these things are interrelated, and can help people to manage their stress, more effectively than anything else that they can do. And we also are tracking stress and depression and anxiety, things of that nature, as we go throughout our program as well with our members. And of course, we can't get into our members' personal lives and really address the financial issues in their lives if they're not really open and honest and truthful with us. And so it's really important that we establish and maintain client rapport and relationship, throughout our program and intervention. And we do that by multiple different ways. One of our core values here at PAC Health is to offer an exceptional experience to our members. So we go above and beyond. So if we know that this client is really not technologically, hip or able or have resources to access technology to kind of go to needy meds, excuse me, then we'll go there for them and download this information and send it to them, mail it to them if we need to, and complete it for them if they need to. For instance, there's one client or a member of mine. She asked me about, dental coverage, that she has Medicaid, Medicare, and of course, many of you know that, dental insurance is not offered through that typically. And so she's really having some issues with her dental care. And so did some research myself and found a nonprofit organization out of Denver, Colorado that, helps people to manage, helps people get free healthcare in their area, and they partner with dentists. And I filled out the application for her, mailed it to her, sent her a self-addressed stamped envelope. All she had to do was sign it, put it in an envelope, mail it out to them. And about 6 months later, she told me that she had gotten the care, and she was so happy that they even went above and beyond themselves and replaced a plate that she had broken. So, so we really go above and beyond with our members and offer that exceptional service. And also, we're client-centered. So much of the medical model that's out there these days is more focused in on as that the clinician is the expert, and in many ways the clinicians are the expert. But in a person's individual life, we defer to our members as the experts. And so we help them to drive the conversation on the call. We're not here to tell them what to do, but we use motivational interviewing, active listening, appreciative inquiry on our calls, where they're coming up with their own solutions. And I remember just in my social work education, that professor told me one time that, if it's your client's idea, they're more apt to do it than if it was your idea. And so we help them to come up with their own ideas, and if need be, and just using motivational interviewing, appreciative inquiry, to make this a conversational approach, and to help them, because we want to help develop their own personal self-efficacy. Because at the end of the day, they may be with us for 3 months, they may be with us for a year, but eventually we're going to go away, and we want them to be to have that ability to manage to self-manage their condition on their own for long term. And some of the best compliments I get, are from my members that tell me that, or clients that tell me, this is about a lifestyle change. This is not about a diet, or it's not about anything, but it's about I'm committed to this for the rest of my life, and say, wow, my job is done. So real excited when that happens. Some other things that we do to continue to maintain client rapport and relationship. We talk about the importance of setting SMART goals. We cite our credentials and experience very early. If we ask them if they have any questions about us, some people say, who are you as a health advisor? What qualifies you to be a health advisor? And so I begin to tell them my credentials and my experience. And they say, oh, okay. So they're okay with that. We set SMART goals with them. We do the tiny step method, as we talked about. We help them to get early success. This is really important, that people have really good success very early in our program, because if they can see that they can do this, that they can change their behaviors, and that it works, then they're going to be really motivated to continue that process overall. So here are some resources of some of the things that, some of the most common things that I just mentioned in this website. I'll also put my email address there if you have any questions, or have any referrals you'd like to send to me, for any of your clients that you might think that we could help. Definitely we'd love to talk to you about that. But we want to open up for any questions here first of all. So I'm going to hand it back over to Rita. I'm going to leave this slide up, so if you want to jot your resources down, go for it. So at this point, if you have any questions, definitely, you can turn those in. I'm going to hand it back over to Rita, and she's going to lead us out from here. She's going to feed me the questions. So anyway.
Michael, you have to change the presenter.
We're doing that now. Thank you.
There you go. Thank you. That was so informative. That was wonderful. Thank you so much. Okay, before we get to the questions, I'm just going to finish up about financial social work and our certifications. And we do have a lot of questions, no surprise, because we always have great participation from our audience. But I just want our audience and those that are new to financial social work to know about our certification. And the financial social work is in the online encyclopedia of social work and in Wikipedia, and practice across the country and around the world. And it includes 20 CEUs for those who need CEUs. Every month we do a free webinar. Next month, on August 16th, we'll be learning how to become a student debt survivor. Last month we did behavioral economics and how it benefits clients. And today, July 12th, we had the greatest webinar ever. Thank you, Michael. We also, on our website, have a new free ebook, Financial Social Work, what it is, what it does, and why it matters in all economic times. You can download that for free. And we have a monthly free download on beginning your personal journey of financial self-discovery. And next week, our July download will be available. All of the previous months are available on our website now. So here we are. Let me open up those questions and get you started. So, great webinar. Just need to see if I can get a copy of the webinar for the resources. We will be sending out that recording next week, and you can go through it as slowly or quickly as you need to find what you need. Someone asked Michael if any of your members struggle with bankruptcy.
I have not personally come across anybody that's had that, nor have I heard of anybody, that struggles with bankruptcy. Yeah, that's a great question. Not that I'm aware of, no.
Okay. When a person has dual coverage, Medicare, Medicaid, and only SSDI or SSI, how do you help them handle their medical needs, especially hospital bills? Are there programs that people can use for financial hardship assistance?
Yeah, what a great question. Definitely, people that I've found working with people who are dual coverage, with Medicare and Medicaid, both, it's been my experience that they have relatively few medical costs because of that, because what one doesn't cover, the other one does. I have come across instances where people with dual coverage, by virtue, they may have 20 medications they're prescribed, and a lot of times they have to, try to just figure out which one is going to cover which medication. Oftentimes that's a struggle, and so we always direct them back to, their clinician, or direct them back to the pharmacist, especially if there's a specific drug that is causing a pain point. Always go back to Needy Meds as a resource to help with those types of issues. Yeah, so that's a great question. We do work with some people, in the lower economic, that they may have that. But definitely, that's probably been, from my experience and just from where I'm working at, because we are a national organization, where we help people nationally. That's pretty much where I'm finding is as the biggest pain point there.
Well, this is why I love our community. I think you'll appreciate this, Michael. One of our graduates just shared with us, hi Larry, that in Cincinnati, 2 Salvation Armies have reduced cost pharmacies for those financially eligible. So that could be worth checking out in your area.
Yeah. Yeah, well, yeah, we definitely, are aware of some of those. I mean, it's it's more locally, situated there, but we definitely, can do that research. Absolutely. Appreciate you sharing that.
The person I think that asked about the bankruptcy shared with us, I think it's the same person, many of that person's young oncology patients have had to declare bankruptcy.
Yeah.
I wonder if that's so they can get more coverage, or if it's because they just have so many medical expenses.
Yeah. Probably the latter, I would imagine, because the cost of cancer care is astronomical, as you can imagine, as well as the emotional aspects of that condition. So, yeah, I think that I think healthcare expenses is still one of the major drivers of bankruptcy in our world today, in our nation today, which is unfortunate.
It is. It's wrong. It is. And I have read in recent years that there would be changes to credit scores separating out the healthcare, but I haven't seen that happen. Have you, Michael? So that
I've not heard anything, no.
I've read that from time to time, but I don't think anything's happened. So here's a question for Pac Health Service. I see that there are free 3-month spots. However, typically, how long does a person start to notice a difference in their goals?
Yeah, it's the research that we've shown internally that I've seen is that about 75 to 77% of our members reach their personal health goal. at the end of the first 3 months, which is really high. I think initially it depends. I mean, I have some people that don't reach their health goals, you know, as you can imagine, because different circumstances happen. They might come down with an illness, or situations happen at home, or something happens in their environment, or whatever it may be outside of their control. But at the same time, I have, you know, people that just start, you just need a little nudge, or some people that it really depends on where they're at in that trans-theoretical model that you mentioned earlier, Rita. You know, if they're really ready to change, if they're in that action phase or or contemplation, then they're ready to set goals, they're ready to move forward. So we help. It depends on where they're at in that theoretical model as well, which we teach and we use here at PAC Health. So you know, and we share that with our members as well. That it's okay if they're not reaching their health goals, and we share that sometimes change takes a little while. Yeah, so sometimes we see it relatively early. Other times it just takes a minute. It's just individual based, yeah.
Absolutely. Someone shared that with ACA, if you don't have your own internet connection or landline, there's no way to apply. It's HIPAA compliant on the patient's end.
That's correct. Yeah. So I've had stories of our health advisors here that just gone on the website, just with the patient a member on the phone, and just you know, help them to fill it out. So,
are you familiar with PAN Foundation?
Yes, I am. Yes.
Someone said PAN Foundation is a good resource for medications copay assistance as Health Well Foundation.
That's correct. Yeah, absolutely. Thank you so much for sharing that. Yeah, that's just one of the resources. In fact, we partnered with Health Well, you know, with one specific project. I know people living with, you know, IPF or interstitial pulmonary fibrosis. We had a program with that, and so definitely, yeah, HealthWell, but those organizations are grant funded, so sometimes it's specific to conditions, maybe rare conditions that maybe insurance won't cover. So you really have to check back with them on a regular basis. Yeah, but I am familiar with them. Thanks.
Medical collections here, this is interesting. Medical collections under a certain amount are no longer supposed to affect credit scores. Thank you, Michelle. And FICO version 9 doesn't allow paid medical collections to negatively affect the score, but not all creditors subscribe to FICO version 9. A lot to know. Let's see. So Michelle, you shared that you can go to Experian.com/blogs and ask Experian / can medical bills affect credit report. Well, thank you. I am going to do that. So let's see, we do have someone with us who shared that she was from Manitoba, Canada. Mm-hmm. And let's see, I think someone said joining from a TRAID training. Is that something you know about? TRAID training? I'm not sure what that is, but that person.
Yeah, I'm not either. It doesn't ring a bell with me.
Okay. Some people wanted to know, how do you find the safer hospital? That's a good question, because you mentioned safer hospital.
Yeah, I think it was on on one of those. Yeah, definitely. It's just, you know, looking at, you know, if you go on rating websites, you know, like, gosh, it escapes my, you know, there's some for hospitals, also some for physicians. The names are escaping me at this moment, but there are, you know, where patients will rate a hospital, you know, or rate a doctor. You know, some of that you have to take with a grain of salt, but you can find those, you know, as well. So
someone put in here TRICARE with a question mark, TRICARE.
yeah, TRICARE is for people, veterans, typically. TRICARE is, you know, it's their, yeah. People who have been in the military, retired military, especially have TRICARE, yes.
Well, we are at the time. We're a little past our time. I'd like to thank you so much, Michael McMorris and PAC Health. I think everyone would like to thank you. Just great information. You're doing great work, and we here at the Center for Financial Social Work appreciate you and our relationship, and I think all of our webinar attendees appreciate you too. So thank you so much, and I'll meet all of you back here next month for Surviving Student Debt. Have a beautiful rest of the day, everybody. Bye now.